So we're pleased today to have with us Dr. Helen Burstin. Dr. Burstin is the EVP and CEO of the Council of Medical Specialty Societies, one of the most remarkable organizations in organized medicine. Dr. Burstin received her MD training at the SUNY Upstate School of Medicine. She received her MPH from Harvard University. Dr. Burstin was an assistant professor at Harvard Medical School and an attending physician at Brigham and Women's Hospital. She went on to serve as SVP and Chief Scientific Officer at the National Quality Forum. And if those weren't enough accomplishments in any one career, she is now, as I mentioned, CEO of CMSS. She'll be sharing with us today original research on the essential challenges faced by professional associations in healthcare. So let me turn it over to you, Dr. Burstin.
My pleasure. Thanks, Kevin. I appreciate the invitation. I'm going to walk through some recent activities that we just did to really try to understand what are the challenges for professional associations for ours and many of our members and many of you on the call today. So for those of you who don't know about CMSS, I've been in the role for about 2 years, and we've tried very much to reinvent, reinvigorate who we are, what we do. So our mission really is to support and strengthen our specialty societies to meet future challenges, look at how we could catalyze improvement through a combination of convening, collaboration, collective voice, and action. And then finally, and I think very importantly, can we help provide a proactive platform to assess and address some of the emerging and really critical issues that are affecting all of us and the patients that we serve. So I think it's a real opportunity for us to think about how we work together. When is the sum of our parts greater than our working only individually across our groups? Just a visual depiction of our members. We really do cross the entire house of medicine, really just excluding just a handful of specialties or subspecialties, and really gratified to see the desire for small, large, different societies, multidisciplinary, physician-focused, really seeing there's real value in working together to try to solve some of our big issues in American medicine today. So as I was thinking about how to present these data, really just this information, I was really struck by the question that Kevin posed for the topic here. What's the essential challenge facing professional associations? And I was reminded of this book that came out a few years back called Bowling Alone. And I think it's one of the things that has always been in the back of my mind as I think about the role of our societies and and other professional associations. The subheading of that book is The Collapse and Revival of American Community. This particular quote from Robert Putnam I thought was really very exemplified, I think, some of our concerns about what can happen in this association space. So the most whimsical yet discomforting bit of evidence of social disengagement in contemporary America that I have discovered is this. More Americans are bowling today than ever before, but bowling in organized leagues has plummeted in the last decade or so. So people may still be involved in their activities, but the question is, do they still value the coming together, the sharing ideas, the being able to do it as a team, as a community, and how do we, as specialty societies, many of you in that space and other kinds of associations, how do we do that in a way that allows us to bring the best of who we are and what we are to the table, and still capture that sense of community and working together? So as we've been doing our work and trying to identify what we want to focus on, we can't boil the ocean, obviously. We felt it was important to identify our 3 biggest priorities around education, quality, and professional identity. These are the ones we came up with even in advance of having this exercise that I'll walk through with you today. And I think they are the example of the places where by working together we can have a significant impact. For example, around defining professionalism, leadership development, new learning models, what does the future of physician competency and expertise look like, just to name a few of them. As we've been doing our work, we've been trying to think about how we can collectively identify and then address what are the biggest challenges. So as we were working through our strategic planning efforts, we thought it would be helpful to work with our society CEOs, 46 currently members, and have them help us envision the state of specialty societies in 2030. I think this is probably analogous to other kinds of professional associations as well. In our world, we were mainly thinking about, in the next 10 years, what are the biggest threats to our organizations? And then what are the biggest opportunities that we can take advantage of to mitigate some of these threats to our societies in the next 3 years? We specifically asked our CEOs to rank their top 3 threats and their top 3 opportunities to their individual societies, as well as to the overall future of specialty societies writ large, not just to your society, but to any society moving forward. What was very interesting was how many opportunities were also identified as threats and vice versa. So we'd have somebody come forward and say, boy, value-based purchasing, this whole movement towards bundles and understanding what this looks like is really a threat. And then another CEO would say, that is such a huge opportunity for us. So I found that just to be an extraordinary example of what you can do when you think differently. Somebody recently told me that they thought the hallmark of a leader was being able to take an opportunity, take a threat, and think of ways to turn it into a strategic opportunity. So we really saw this exercise in that way. I've taken advantage of some coloring here, and so the threats that I'll show you on the next slides are in red, the opportunities are in green, and the things that were identified as both a threat and an opportunity are in blue, and I'll walk through each of these. So we walked through a whole series of categories, and I'll give you some of these, and obviously for many of you in this space, membership always looms large as you think about your ability to keep people engaged, understand what are your opportunities for growth, etc. So a couple of really important opportunities that were identified. A number of our societies, actually the vast majority of them, now allow some form of multidisciplinary membership, physicians, non-physicians, scientists, others, for example. One of our societies had a nurse, for example, as their president about a year ago. I think that is one area that was identified as a significant opportunity. There are some challenges there as well. Does the content of your educational opportunities vary? Is it all directed at the same way? How does it change governance? So there's certainly some opportunities and threats in there, but I think overall that was considered an opportunity. Similarly, it was remarkable to me how many of our societies are now fully embracing how they can play in the international space. Significant international expansion into some places, particularly Southeast Asia, Latin America. Within a couple that were identified as both threats and opportunities, what do we know about member engagement among younger physicians in our example? Will they be as likely to join, going back to the Bowling Together example, will they see the same value in the sense of community and camaraderie that specialty society meetings bring to so many of us? Actually, at a meeting today at ACGME on parental leave policies, somebody made the example of how one of the societies has now introduced at their annual meetings, they have a young physician, just a group, a lounge, and then they have a parents lounge to allow some of that interaction to happen for people. But again, how do you engage younger physicians is both a threat and an opportunity. Certainly this issue around diversity and inclusion of both women and underrepresented minorities presents an opportunity and a threat. Many of our organizations have diversity and inclusion task forces, statements, efforts that are ongoing to make sure there are ways to both ensure that those who are within their societies have leadership opportunities that help them advance, but also a great deal of attention to what specialty societies could do to advance the pathways into medicine among particularly underrepresented minorities. Two threats that I think are concerning, but also can be viewed, at least the next one, in a way of around opportunities, is how do we look at the allegiance of employed physicians? Depending on the specialty, it's probably upwards of about 60 to 80% of physicians are now employed by health systems. Very fewer and fewer physicians are in individual practice. And so if you are going to them to join your group, who is their allegiance to? Is it increasingly to the large health system that is paying their salary and providing their benefits, or is it to their specialty society? And are there opportunities to bring those closer together? A number of our societies, for example, now offer group membership where the health system purchases membership for all of their physicians in that specialty to join. Those are opportunities for us to think that through. But certainly the allegiance is different. If your health system is offering you all your CME, for example, are you still going to come to your specialty society meeting to get CME, and how do we ensure that that comes together. The last one is a real concern, and this goes back to the bowling together thing. Certainly, I think, are we going to begin to see different levels of member apathy and volunteer burnout if people aren't as invested in that? I will say that although this was rated as something we wanted to keep an eye on, it did not rise to the top. It was not at the top of the heap of concerns. It was just something I think we needed to better understand and keep an eye on. Most people have not seen that happen yet, but if you're thinking 10 years out, you have to think about what even may not be happening yet, but is of concern. The second big area that was primarily around the opportunity side was this issue of where specialty societies and others, professional associations, could engage in this broad issue of data and research. As many of you know, many of our societies are engaged in research and data analytics. Many of them have clinical registries. I think at last count about 30 of our societies have clinical registries. Huge opportunities there, but we recognize that there are some opportunities that could also be threats, in particular this issue of big data competition. How do we have the Googles and the Apples look to the specialty societies as the thought leaders around knowledge, around the right research questions, around, does our role change, but how do we ensure that they look to us in a different way rather than having them simply take this on without us? And then lastly, this idea of payment reform was viewed as a mixed opportunity. I think it can be disconcerting to many specialties to not understand what the future of payment would look like, but for many it's also been considered a real opportunity to think, what does a patient-focused episode look like? How do we begin thinking about how population health fits into our overall assessment of our priorities? So I think this big one, data and research, is clearly one we want to keep an eye on and make sure we're doing everything we can to stay ahead of the curve. And for many of you, certainly, who are working with this group, obviously education is going to be very, very high on your priority list. And I think there was overall a sense that we still have a huge opportunity around being the disseminators of knowledge, especially high quality evidence-based knowledge, and that we need to do that in a way that keeps up with the technology that's driving and changing so much of the way CME is provided, for example, simulation, electronic formats, et cetera. Interesting discussion we had at this meeting about recognizing what's different about some of our younger physicians, for example, who are digital natives. They've never lived in an environment where everything wasn't available online or on their smartphones. And what does dissemination look like to them? The challenge here, the real concern, is that we're increasingly seeing CME provided by health systems, as I mentioned, increasingly by for-profit entities and companies, and then also some smaller competitor societies. So this is an area that I think we all collectively need to keep up with. What are the newest advances in learning and best ways to provide that information that's more accessible within practice, and we can really demonstrate its value rather than simply saying number of people with X number of hours in seats at our meeting. So the other big issue that came up was, some of these issues are not central to professional associations, but they're really the externalities that affect our members. So there's a set of broader issues as well. Certainly payment reform, as I mentioned, is considered an opportunity, but there's also a bigger threat. And I think one of the other issues we talked a lot about was the corporatization of medicine, the consolidation within medicine. Understanding the role of private equity is something we all need to, as we look out 10 years, increasingly keep an eye on, understand what its impact will be on in our world. You've probably seen, just even in the last week, for example, some very large VC company that did dermatology practices went belly up, and I think there's lots of concerns about what that means for the longer term. So we took this information, we had a great session with our CEOs, worked through it with a wonderful facilitator, and ultimately used it as a way to drive what are our strategic initiatives for the coming year, and in some instances 2 years. And I'll just highlight the 4 that we came out with that were really a compilation of many of these threats and opportunities. First, we've identified this digital transformation as being one of the most important things we need to get ahead of the curve on. Can we focus on physician education, patient-focused principles around specialty medicine, where the clinical registries, big data, artificial intelligence all come together, knowledge management. We've actually decided to launch this effort at our Digital Transformation Summit, which is open to the public, here in Chicago, April 29th to 30th. we're also going to include in there some, I think, very important thoughts around what we can do to help safeguard patient privacy and ethics around the use of patient data. So that's our first big initiative. Our second one that emerged out of this was some very focused attention on diversity, inclusion, and engagement. What are the best practices across our societies to engage and help support women, younger physicians, underrepresented minority across all specialties, including getting them into the pipeline in the first place, including getting greater representation of underrepresented minorities into medicine. So we are going to have our first session on that at our spring meeting on May 1st, bringing in some organizations will help us think that through, and then we're actually going to start working on an effort to begin collating all of the work across the diversity and inclusion efforts across the societies, begin to identify some best practices, and begin sharing some of those. Again, huge opportunity, I think, for us to share that information across all of our groups. So the last two we picked were one broad one focused on this issue around physician competency and expertise. We already have a task force that's been helping us think through this future vision, but I think it broadened it out to begin helping us really take more of a broad look at what do we know about advances in physician learning, how best to use that, how best to use technology, how best to fill gaps, and how that relates to the broader assessment initiatives, for example, of the specialty boards and others. And then finally, as I mentioned, one of the last threats there, really beginning to understand the corporatization and consolidation within medicine and understanding what its impact might be on our physicians, our member societies, and others. What is it? How do we survive, leverage, and prosper, as a group of our CEOs said, in an era of consolidation and commercialization within medicine? We'll begin doing some early work on this year, reaching out to our societies to begin understanding what the impact thus far has been. But I think a lot of this is very much future focused around where we think the concerns will be, and having us all stay very, very aware of that. So I just included this last slide here from Albert Einstein because I thought it was sort of poignant for us that we can't solve our problems with the same thinking we used to create when we created them. And that, you know, at times I think professional associations are created in a very different time and place. And there's really an opportunity for us here to think differently about what we can bring to the table to re-envision what a professional association means, does, and how we can really contribute to the broader good for patients and the members that we serve. So I think with that, Kevin, I'm going to wrap it up and turn it back over to you to do Q&A.
Thank you, Dr. Burstin. That was a great presentation, a lot of important information for all of us involved with professional associations. I'm going to open it up for questions in just a moment, but while people are thinking about formulating their questions, let me start by just asking, you mentioned digital transformation, you mentioned the need for societies to be thinking differently, as your last slide illustrates. Do you see the healthcare provider of the future, and I don't mean the distant future, I mean over the next decade, as having a very different toolkit than the provider that the traditional provider profile that we're more accustomed to?
Oh, absolutely. I mean, I think it's sort of a yes and. So yes, I think there will be some newer tools we're going to have in our old black bag. But I think we also have to do everything we can to ensure that some of the things that have worked really, really well and need to be even better don't get lost in that. So, for example, the classic example of how EHRs have made docs stare at their screen instead of talking to their patient. So I think we need to be very cautious of when these new tools seem like they're going to make things better, but always be on the lookout for unintended consequences. That being said, I think that certainly understanding how things like machine learning, AI, and telemedicine come forward are going to be hard to imagine we can do our work moving forward without them. One of our CEOs, Bill Horwath from the American College of Radiology, at our last meeting said, will AI, what's the effect of AI on radiology? Always a question that comes up. And he said his thought was that radiologists who use AI will be at a huge advantage to radiologists who don't. And that's why I think we have to look at how we can incorporate them better into our practice. I still preset medical residence half-day week, and really struck by how many of my residents in the Mid-Atlantic region will likely go work for Kaiser, and how most of them have never done any telemedicine during their residency, even though that's going to be a pretty important part of what they're going to do at a place like Kaiser. So I think the tools are going to change, and I think we have to begin teaching our residence fellows and helping those of us who have been out there for a while retool and think differently about how we use these tools, but always keep an eye on what are the potential for unintended consequences.
Excellent points. Let me open it up and ask if there are any questions amongst the participants. I'm not hearing any yet, so let me just, to build on the point you just made,
yes.
I'm a big proponent of AI, and I can see an important role for it in the practice of medicine. But as there's a saying out there that goes something along the lines of the AI can nominate, but the clinician must validate. And whatever skill set that we evolve to, great physical diagnosticians at the bedside with a profound understanding of their patient is never going to, it's always going to be necessary, and perhaps even more necessary when we're relying on algorithms for more and more of our decision making.
Interesting. That's a really interesting point. I think that that is something we've all thought a lot about. I actually like that nominate, validate piece. And the recent experiences of discovering how some of the AI algorithms were built on existing data that simply were perpetuating disparities in care is a classic example of that. We need to be cautious about things that, for example, based on prior utilization suggest what is appropriate, even if that prior utilization was in fact underutilization. But I also think we have to be a little careful about the fact that some of these newer tools will show us some things that we just may not have thought about, truly. So the ability, for example, of AI or machine learning to introduce a broader view on what the possible diagnoses could be is an important piece of this. We're doing some work currently with a Society to Improve Diagnosis in Medicine with some support from the Moore Foundation to begin understanding how do some of these new data platforms help improve the ability to do better, more timely diagnoses. So, sometimes we get an idea in our head of what is the next logical diagnosis for a patient, and we tend to put our blinders on and don't think about the other possibilities. So I think it may be that you have to both think about, both nominating and validating, but maybe sometimes be very cautious of the fact that sometimes those ideas coming forward to you for machine learning, which is really just looking at patterns of associations, could introduce some thinking to you that you just may not even have considered, even with your vast clinician skills.
Excellent points. Let me ask again if any of the participants have a question for Dr. Burstin at this time. Well, hearing none, it's the tradition of this webinar that we try to keep it tight on time, because we know there's a lot of busy people who are carving time out of their day for this. So I want to thank Dr. Burstin for a very thought-provoking presentation. I'm very excited about the Digital Transformation Conference that you'll be putting on in Chicago, April 29th and 30th. It is certainly a topic that is of the moment for all professional associations, and I'm sure there's going to be a lot of great content coming out of that. So with that, thank you, Dr. Burstin, and we'll conclude today's webinar.